is one risk factor for cardiovascular disease. It means that as people age, elderly people, till part of middle age elderly people, the propensity for these things to happen becomes higher. That is why if you sample, get that device they use in checking BP and check the blood pressure of people here and categorize them, you will notice that majority of the people that have hypertension are amongst the elderly people. The older, the higher the risk. The younger men and women, few of them, just very few will have. So you can't help the fact that we all age. So as you age, your risk for cardiovascular disease increases. So that's one non-modifiable risk factor. Another non-modifiable risk factor, which always makes us laugh in medical school, is male, being a male. Being a man, male gender, is one of the non-modifiable risk factors. We always argue in school, everything cardiovascular disease, they say male risk factor. Why? We are not very sure why it's seen more in males. Although some will say at a younger age, the hormone estrogen that women produce is protective to their cardiovascular system. So that's why when a woman goes beyond menopause, the risk starts equaling that of men, because estrogen will start, production of estrogen will drop in them, so the risk becomes the same with men. Actually, post-menopausal, the risk is the same. So one non-modifiable one is gender. You can't change your gender, so it's there. Another one that is here with us too is race. Yes, the black race has higher propensity, higher likelihood for cardiovascular disease. We do not know why, but race, R-A-C-E, or ethnicity, if you want to use ethnicity, fine. So the black race has a higher chance of having a cardiovascular disease. So it's been found from steady studies over the years. So these are just some of the non-modifiable. I didn't finish all of them. Then we'll go over to the one we can do something about. And so we don't dwell much on this one, but this one we can't do anything about it. The modifiable risk factors, the one we can do something about. I've already mentioned the one we check with his feet. Hypertension. Hypertension is a risk factor for cardiovascular disease. Funny thing is that if you count 10 people here, at least 4 of them are likely hypertensive. That's the way it is. It's increasing every year in the whole world. Over 40% of adults in the whole world have hypertension. So hypertension is actually here. And that's why as an adult, before when I was younger in medical school, the story is nothing that happens in 40 years. When we get to 40, we can start checking BP, whether it has come up or not. But now, after over 10 years of practice, I've had patients who are 22 years, 24 years, 28 years, the 30, there are plenty. So many people in the 30s who are hypertensive. So, whether it's urbanization or westernization, which people are saying may be a cause, the truth is that the age of hypertension have come down. It has decreased over the years to involve even 30s and late 20s. So it's important once in a while to check your blood pressure. No. You just have to check your blood pressure. I'm not saying it so that I will put fear. If you are not hypertensive, fine. If it's once in 3 months, once in 6 months, you can check. But if you have a family history of hypertension, you can check more often. It can be once a month or once in 2 months. You are not doing it because you are inviting it. You are doing it to be proactive. Yes, because hypertension is here with us, but the good part is that the medication is everywhere. The medications are everywhere. They are everywhere. So you shouldn't allow yourself go down for something the treatment is found everywhere. So you need to find it early before it causes any problem at all. So hypertension is one. That's the one we will dwell a little bit more on. Another risk factor there is diabetes. Diabetes. Many of us know diabetes. The one, oral sugar. Oral sugar, the one that has to do with sugar control. It's a big risk factor. When it's there, it can affect the heart, it can affect the vessels and cause clots, and so many things can affect virtually all organs, just like hypertension. So it's important that we also measure our blood sugar once in a while, just as routine checkup. What other thing in the modifiable section? Yes, the one that we can do something immediately about. Physical inactivity. Physical inactivity. You may be slim, but you hardly ever walk around. Trust us in Nigeria. We finish in the house, we enter our car, we drive. Maybe it's because of this current situation that people are now walking even more. But back then, you finish, you wake up, you enter your car, you drive to an AC office, you sit there, you walk behind the system. In the evening, you enter the car, you go back. No form of serious physical activity. So that is a big risk factor for cardiovascular disease. Which other one do we have here? The brother, obesity. Obesity, yes. When our weight is so much. Many of us, my own weight is overweight too. As I am here, I'm overweight and almost obese. I'm almost touching obesity. So that's why every week, despite the heavy schedule, I have to find a way to go and play football. I'm not playing it just because I like it. I'm playing it because it's something I must do. It's something that is important. So everybody must battle physical inactivity and obesity. Yes, we must do that. And the way we do that is by exercising and doing healthy diets. So it's important that we take note of that risk factor and how to handle it. Which other risk factor do we have? We also have the one you call cholesterol. If somebody will say, I went to check my cholesterol, I went to check my cholesterol. The general name for them is lipids, L-I-P-I-D-S, L-I-P-I-D-S. That one is the totality of the cholesterols. There is good cholesterol, bad cholesterol. When you check them and the totality shows negative, it tells the negative side. That's when you see you have a cholesterol problem. Not just when you do one and you say cholesterol. So that one also affects the cardiovascular system and is something that we need to look at. Which other modifiable one? Smoking. Smoking is a serious risk factor for cardiovascular disease. In fact, in our treatment module for all the textbooks, they write it smoking cessation. You don't even need to reduce, you need to stop entirely because it's bad for the cardiovascular system. Then the broader alcohol is another serious risk factor for cardiovascular disease. Alcohol is written reduction. Formerly, it was an argument for many people, especially for us who are medics in the church. When we go outside, the textbook says there is a limit for the man, there is a limit for the woman. They may say, okay, in a week, for males, don't do more than 6 bottles spread in the week. For the females, don't do more than 5 bottles. But for us who are Christian medics, of course, that preach abstinence, it's a thin line, it's a gray area, because what the book says as medics, we have to say the truth. But this has been a story from my medical school. Fast forward 10, 14 years now, World Health Organization is now saying that whatever quantity of alcohol you consume has effect on the cardiovascular system. So before, remember, it was don't take more than 6 bottles, don't take more than 5. Now they have done research over the years, and they have now agreed that whatever quantity has a risk, choose your risk. So alcohol is the modifiable risk factor.